Hello, everyone, and welcome to our webinar, How to Improve Communication Between Muted. The webinar will last 45 minutes, and we will have dedicated time after the presentation for Q&A. If you have questions throughout, simply type them in the comments section, and we will address during the Q&A time. The webinar is being recorded, and we will send to all participants afterwards. Our speaker for today is Greg Grasso. Greg is the Director of Enterprise Solutions for iCare Leaders. We appreciate you taking time of your busy schedule and join us today. At this time, I will turn the webinar over to Greg. Greg?
All right, thank you very much. And hello, everybody, for joining us today. Really appreciate the time. And my name is Greg Grasso. As Teresa said, I'm the Director of Enterprise Solutions here at iCare Leaders. And I'm going to be walking you through the webinar of how to improve communication between practices and the surgery center. So first off, no part of this presentation may be reproduced or transmuted in any form or by any means, graphically, electronically, or mechanically, including photocopying, recording, or taping without the express written permission of iCare Leaders. So let's go over some of the webinar goals for today. So obviously I'm going to be giving you a lot of information, and of course we're going to have the Q&A at the end of it, but I just want to talk about what we're looking to accomplish here with this webinar, and exactly what we're going to touch on, and also go over a little bit of demonstration of the MyCare iMedicWare IASC link. So that's a big piece of today and our communication between the practices and surgery centers. So I think you're really going to like what we have to present, but also with these other goals, we'll go into how we can recognize the return on investment of implementing the strategies presented during this webinar. We'll go over and optimize the clinical, financial, and operational alignment from clinic to surgery center. So I want to talk about just issues about going into research, cost control, and how we're going to optimize, again, that entire practice of clinical, financial, and operational workflows that you have going on, both on the clinic side as well as the surgery center. And then we'll outline the best strategy when researching solution partners in order to effectively grow your practice while achieving a higher level of patient care. So that's a big one that I'm going to jump into basically right off the bat. I just want to go over kind of what I've seen over the years and the best way to outline the strategy when you're going in and researching the different solutions that are out there. Because obviously we can all do a very excellent demo and it's going to look very nice right off the bat, but I want you to go in with a game plan, because that's how you're going to basically decide what's perfect for your practice and what's unique for your specific goals and your workflows. Because obviously you know your practice, and any of us as the solution vendors are going to be able to know. So going in with a little bit of a game plan and some background of exactly what you're looking for is going to help the partner that you're trying to grow with as a vendor, as well as when you're doing your due diligence and trying to do your research for your different solutions. And then lastly, we'll wrap up with a demonstration of that IASC link, followed by the Q&A. Now to start off, we'll talk a little bit about the research. So I just want to point out, it's just what might seem like obvious cases, but again, the more work you put in the front end is going to overall help you when you're choosing that final solution and making sure it's correct for your practice and the overall flow that's going to have with the transition of also the training and also just your practice and your team's commitment into moving into that solution that you've finally chosen. So do your due diligence. There's a lot out there. Obviously, go in and research. I've had practices go out and actually assign 1 or 2 main people to go out and just start reviewing the different vendors that are out there, make sure that they have all the correct options that are needed for your specific practice or surgery center, and just make sure you're going out there and checking on everything that's out there to be demoed and actually presented to your practice or surgery center. Also too, it also helps before that to set a precedent for must-haves and detail what is unique to your practice. So your practice has your own set of workflows, staffing situations, do you have scribes, for the nurses in the surgery center or in the clinic side of things, exactly how your workflow might be different than what you've seen at other practices, either within your area or across the country. So it always helps just to set a precedent of exactly what you're looking for, as well as what's unique. So everybody's practice is a little bit different, and you want to actually get that information out there first, so you're not just getting that standard, 20 to 30 minute, here's everything we have demo. Don't really ask any questions or go off the rails. Just kind of ask your pain points and what's unique, so they can kind of highlight that during their normal presentation. Also, try to recognize the process of the transition prior to going in. So it also includes your practice's infrastructure. So depending on whether you're looking for cloud-based, browser-based, or in-house servers, obviously start recognizing that process first. So when it's actually time to choose the route that you're going, you know exactly what's going to be needed on the practice's infrastructure side, instead of like coming into that at the last moment and then realizing that you're going to have to add some additional features into your surgery center or into the clinic itself. Also, too, ask as many questions as possible. They say like there's no dumb questions. So always just go in, make sure everyone's being heard that's going to be using the different solutions, and make sure everyone in the practice is like getting their feedback and their questions answered. Like you don't want to go in and just make sure that you have like the nurses or techs or whoever else are just kind of coming and seeing it last minute. They're going to be using the solution as well, and also they're going to be an integral part to the efficiency of the overall practice or surgery center when it comes time to using these different strategies that we're going to go over. That also leads into the commitment from your staff. So, one bad apple kind of ruins the bunch. So just make sure like everyone is on board, everyone's excited, and everybody's looking forward to, making this commitment and moving forward with a solution that's going to end up helping you with your communication between both practice and surgery center. And basically everybody's going in for their trainings knowing like I'm ready for this and to help our practice and surgery center reach its goals moving forward. And then lastly, give yourself a deadline. I've seen a lot of times where I've been working with practices for a year, sometimes longer. I'm not saying you need to have a set deadline, but it also helps just to go in with some kind of time frame of when you're looking to have a decision by. Taking up your time for your physicians, the surgeons, nurses, techs, billing staff, and everything else. And then all of a sudden, no deadline was created, so it kind of gets pushed on the back burner for a little bit. Then all of a sudden, it comes back around, and it feels like you have to start all over again. And before you know it, you've spent numerous hours and just time and effort going into researching, where if you just set a standard deadline right off the bat, it at least gives you a chance to basically know what you're zeroing in on and which one's going to be best for you. Now, when it comes to optimizing clinical, financial, and operational alignment, one thing I like to talk about is just cost control. So you want to give your practice excess visibility when it comes into looking into the ASC. So inventory management is probably a big piece when you're figuring out like the best way to optimize your financial and operational alignment. Like you want to know that everything's being tracked, because nothing can sidetrack a practice or surgery center more than having to recover from an inventory problem and have to go through the challenges and expenses that come with that. Now, cost per analysis between labor, time, and materials is a great way to look into the surgery center when you're going in to check for vendor information as well as the different solutions that are out there. You're going to want to be able to know like exactly what's going into each particular procedure that you're having, an encounter that's going on, and also like what's being used during those cases. So anything that can offer different reports, which I'm actually going to bring up a few right now, is going to be beneficial for both the practice and the surgery center. So right now we're looking at procedure cost analysis reports. So just any reports that you can get from any of these different vendors out there and different solutions that show you just total procedure cost per surgeons or just overall supplies that are being used are going to be extremely beneficial for both the practice and the surgery center. Because obviously as the two are communicating back and forth, then you're going to be able to run these different cost comparisons and just exactly see like how the efficiency of getting the correct information over from the practice to the surgery center is benefiting the surgery center in the long run. So over here we have procedure cost analysis reports and just overall surgeon data and average cost per, as well as let's kind of look into supplies cost analysis. So just different ways that you can understand exactly what's coming over from the practice to the surgery center, and also the information that's coming back into your practice management system that you can basically run other reports on as well when it comes to just looking at overall efficiency within your practice. Also, cost per surgeon is a good way to look at your overall optimizing of clinical, financial, and operational alignment. And then lastly, your outcome measures. So this is a key one. So after a surgeon completes their case, these measures allow to see vision success, for example, of like 20/40 or better, and if there are any post-op complications. So this information feeding back into your practice is going to help with overall patient care within the surgery center, as well as obviously with the practice when you're going over those post-op exams to see what's going on. Now, we're going to start talking more about MyCare iMedicWare, and I am the Director of Enterprise Solutions here at iMedicWare, and I deal a lot with MyCare iMedicWare. So we're going to be going into their ambulatory surgery center module and speaking more on that. And that's basically where we're going to go into the IASC link. And that's where that communication between the practice and surgery center is really going to shine, because we have a bunch of different features within the IASC link that's basically going to put the onus back on the clinic side and basically give the surgical coordinators the opportunity to see exactly what's coming in from the practice per patient, per encounter, and make sure everyone's on the same page at the same time. Now, with MyCare iMedicWare, I do want to point out that we are the official EMR of OOS, which is the Outpatient Ophthalmic Surgery Society. And with iMedicWare, we have adaptive templates, customized consent forms, patient questionnaires, physician profiles, and post-operative orders. We integrated pre-op and post-op patient care, as well as do a real-time audit within the ASC EHR itself. Now, when I get into some of these patient questionnaires, H&Ps, consent forms, we're going to go into the IASC link and kind of run through all of that and see exactly how the practice is going to be able to sync this information over, or actually upload, scan it into the booking sheet manager that gets synced over to the ASC. So it's going to make sure everyone's on the same page and all the proper documentation is available prior to the date of surgery. Now with iMedicWare, and again, this depends on your research on what you're looking to do. We are a cloud-based solution, so just keep in mind like exactly if that's what you're looking for, with the way that you can allow users to log in and access records basically from anywhere, anytime, any place, as long as you have access to the internet. It allows physicians to work on vacation, even though that sounds like kind of a nightmare, and it allows for multiple users to be in the same account. So it just depends on the research that you put in prior of exactly what's going to work best for your staff, your practice, your surgery center, and see exactly like the best way to move forward and make sure you're taking care of your patients and being able to record everything and document everything properly. Now with iMedicWare and iCare Leaders and MyCare iMedicWare, we have our surgical chart and workflow with seamless integration with the EHR. So remote surgical case scheduling as I go into the IASC link, audit of surgical encounters in real time again with those health questionnaires, nurses and physician records, anesthesia records, surgeon profiles, and then customizable consents and discharge instructions. So those are all things that can be integrated together. So as you're going through encounters and putting together the discharge summary, it's actually going to make sure everything's accounted for, everything's being signed off properly, and we're meeting all of our regulatory needs. That's a lot of things that I've seen with ASCs when they're evaluating a surgical center EMR. The workflows don't take into account how their current processes might be adding additional work for the staff, which isn't really necessary for regulatory requirements. Now, I don't want to say that I want to change the way that you're doing your workflow and run your surgery center, but it's something to keep in mind when it's time to run overall efficiency reports and monitor exactly what's being entered into your ASC. Now the IASC link, and this is where we're going to go into the demonstration, manages the surgery booking sheet for multiple practices. It synchronizes practices and the surgery center and simplifies charting of surgical patient records. So let's just kind of dive into the demonstration for that. So this is our IASC link, and it's our booking sheet manager with MyCare iMedicWare. And the great part about this is whether you're using iMedicWare itself in the ASC as the EMR or your PM, or if you have a different solution out there that you're using and just using iMedicWare as ASC, or even if you're allowing outside practices to use your surgery center, everyone's going to be able to use this IASC link. So it's going to make sure and put the onus back on those outside practices and make sure that they're filling in all the necessary documentation and filling in the proper information for both health questionnaires, H&Ps, insurance info, allergies, syncing IOL information and surgical planning sheets, all built in to this IASC link and booking sheet manager. So if you have iMedicWare's EMR, PM, and ASC, all this information will sync over from the clinic to this booking sheet manager. So if the consent forms, IOLs, ocular history, health questionnaires have all been filled out in the clinic side, it will sync over when it's scheduled from the MyCare iMedicWare PM. Now, this also is going to be a collaborative space for everything pre-surgery. So if nurses need to fill out health questionnaires, it's all real time within this system. So anything that's a red X is basically saying this information hasn't been scanned, synced, or uploaded to the iMedicWare ISC booking sheet manager. Anything with the green check marks means they have. And then even from here, it can sync over information like demographics, insurance information, and the scheduling information directly into the booking sheet manager. So you'll know demographics, surgery time. Also, you can schedule pickup and arrival times right from here. And again, those nurses can fill out that other prior information. So if they need to fill out the health questionnaire, since it is browser-based, they can just do it within the clinic or the surgery center and just fill in the pre-op information right from here. And then save and close, and it will all update in real time. And then when you hit the refresh button, those red X's turn to those green check marks. Now your surgical coordinators can get consent forms signed off on if they are missing, and that's right over here for our consents. So this patient hasn't John Doe, and we can just go in, update our consent for that particular type of surgery by either using a signature pad or just like you can use like a mouse in the clinic side just to make sure they're signing off on everything, or just upload a piece of paper that's already signed into the surgical booking manager as well. H&Ps can also be uploaded if needed. So let's go into an H&P. I don't think we have one built into the dummy site, but they can be scanned or uploaded directly into here as well. And when this syncs over into the actual iMedicWare ASC EHR, it can actually show you if it's been over 30 days with alerts that will pop up during the nurse's workflow. Now, if you don't have iMedicWare's EMR or PM and it's your surgery center, then we can bridge the ASC link to your PM system. So when you book a patient for surgery, their demographics, insurance, and scheduling information will sync automatically. Then you can just manually enter the rest of these fields. So if I need to enter in medications, I can add this information in on the fly. Same thing with allergies. Also any IOL information. If my EMR has surgical planning sheets, that's something that can be synced over as well. As well as being able to allow them to choose their own IOL manufacturers. So I can just come in, choose the lens brand, model, and update that new information within the booking sheet. Now, if you allow outside surgeons into your ASC, this is where it's also key. So even if that outside surgeon's using something completely different, they're still on paper, it's going to allow them to use this booking sheet manager as well too. So they'll receive this and be able to book their surgeries themselves. Again, they won't really have the bridge to bring in information, but they can manually enter the specific fields. Now, I know probably some of you are asking, like, I don't want them to be able to see all this other information, but based on that specific facility or that outside surgeon or the clinic side, the surgical coordinator is going to basically dictate what they can see. So those outside surgeons, or even on your own clinic side, if you only want them to be able to see specific dates that they can book surgeries, then you can customize that so they can only see those specific dates. And as well, they're not going to be able to see anybody else's surgeries that have been booked. It's going to be strictly designed for their particular surgeons and their facility and what they can see from the main page. But obviously, as a surgical coordinator, they're going to have the entire overview and basically the master key to basically see everything that's being uploaded, sent in, what hasn't been uploaded yet, and the red X's before everything gets synced over to the actual ASC EMR. Now, again, for those outside practices that won't be able to have their demographics sync in, they're going to be able to go into their patient detail, put in patient's name, last name, date of birth, booking for their particular surgeon with the type of procedure or any secondary that need to be put in, and again, any comments that they want to have in place for that particular surgery. Okay. I can also create to-do lists, delete patients, or again, upload PDFs if needed before I sync all this information over to the surgery center itself. Now, lastly too, is our ability to scan a driver's license. So every driver's license has that unique barcode on the back of it. And with that unique barcode, it's actually going to allow you to scan the barcode and actually drop in specific demographic information, as long as the information on that driver's license is up to date and the driver's license hasn't expired yet. So the name, last name, date of birth, address will all be put in from that driver's license. And then when we sync, it will go over to the ASC. And as well, if you're using MyCare iMedicWare, it's actually going to give you the opportunity when you finish an encounter, it's going to take all the pertinent documents, the different reports that you've been able to run, as well as the discharge summary with all the different codes for facility, anesthesia, surgeon, and sync the information back into iMedicWare's EMR and PM. So you can run different reports on that as well. So in conclusion, I just want to talk a little bit about iCare Leaders and just the different opportunities that we have. So as you look to streamline, be sure to keep the MyCare suite in mind. You have a choice and flexibility for a fully integrated workflow that works for your practice and your practice's needs. With everything from EHR to revenue cycle to analytics, the completely integrated solutions and services are designed to shoulder the operational burden associated with running your practice and surgery center by streamlining every aspect of it. Now, I do want to remind everyone that on May 30th, we have a webinar, Increase Revenue by Better Understanding Healthcare Payment Practices. It's going to be hosted by Annie, our compliance director, and she's going to be able to discuss specific scenarios and common mistakes made in practices that can have negative impacts on revenue. Also going to be describing how denials and appeals work, including the importance of having a strong denial management program, plus much, much more. So don't forget to sign up now at iCareLeaders.com. Also, if you haven't signed up already, don't forget to register now for the ECL Summit. So go to eclsummit.com and register early and try to take advantage of our promotions that we have going on right now, like our register early for the best rate, as well as bring in 3 or more staff members and get a $50 rebate off registration. So our One User Summit, it has a keynote speaker of ZDogg, the voice of healthcare 3.0, and it's running September 14th to the 16th, 2018. And if anybody hasn't had a chance to view the World Center Marriott in Orlando, Florida, I mean, just go to their website and check it out. It's going to be an awesome event. And then also too, I'm actually bringing my family down after. So it's really close to all the different venues and theme parks that you have out there as well. So it's going to be a great event. Make sure you're registering for it and sign up when you can. So now I guess we'll open it up for questions. I'm not sure, Teresa, if you'd had a chance to get any questions during the actual meeting.
We do not have any questions at this time.
No, okay. All right, so it seems like I was hoping to give more time for questions at the end, but I really appreciate all the time that everyone spent today to come in and view our demonstration. Of course, you can always speak with us again. You'll have the recording sent you, but if there's questions that as you watch recordings again or things that come up later on, obviously we all have busy days as we're taking the time for the demonstration, but you'll be able to come in and send us some emails and we'll be able to answer questions one-on-one if needed. I can always be free to give you a call and kind of run through the uniqueness of your practice and surgery center and just make sure that we answer all your questions that are specific to you and your specific needs.
Thank you, Greg. This concludes our webinar. Thank you for joining today.